Violence and aggression in nursing and the hindrance to a healthy workplace and ensuring patient safety. Workplace violence is described as an occurrence where a person is abused, threatened, or assaulted during the course of their work. Examples include biting, spitting, kicking, pushing, grabbing, throwing objects, and verbal insults and threats. Nursing staff are frontline responders and are statistically placed at a higher risk for exposure to workplace violence. A recent study conducted by Monash University into occupational health and safety in nursing found that up to 70% of nurses and midwives have experienced violence and aggression in the last year, and 25% advised it was a regular occurrence. Both the frequency and severity of the attacks are increasing, and predominantly the patients were perpetrators of the assault, but alarmingly 18% of incidents were at the hands of colleagues. An Australian study of 380 participant nurses found that 71% had experienced aggressive behaviour, with acts originating from doctors and 61% from other nursing staff. Reported behaviour includes verbal insults, incivility, and rumours regarding personal life. It is estimated that as little as 1 in 5 nurses report violence, with research finding many occurrences go unreported due to nursing staff accepting that violence as a routine part of the job and not viewing the matter as serious if there was no physical injury sustained. A study of the attitudes to reporting violence and associated barriers found that reasoning for not formally reporting included lack of management support, unclear procedural policy, and length of time to file the report. Instead, a number of informal techniques were used, such as documenting in a patient's medical record or confiding in other staff or colleagues. A systematic review on aggression in the workplace found that younger and less experienced nurses were more at risk of violence in the workplace, and that physical assaults were common on night shift and weekends, and male staff were almost twice as likely to be victims. The study found that nurses were more likely to be exposed to violence throughout their career due to increased time spent with the patient, and also the fact that doctors are perceived as senior to that of nurses. Workplace violence has a detrimental effect on the health of the workplace, the employee's psychological and physical health, and economical cost to the organisation. Post-incident, victims reported to experience shock, sadness, confusion, anger, and embarrassment. Over the longer term, exposure to traumatic incidents contribute to low morale, poor recruitment, poor retention, depression and anxiety, and self-medication with drugs and alcohol. Violence in the workplace also jeopardizes quality practice and patient safety, with disruptive behaviour resulting in ineffective or substandard care, poor adherence to policy, increased medical errors, and adverse outcomes. The Australian Nursing and Midwifery Federation policy on violence and aggression in the workplace outlines that nurses, midwives, and assistants have a right to work in an environment free of violence and aggression. Further, it states that employers are obligated to eliminate or minimise risks, appoint health and safety representatives, and comply with work health and safety legislation. However, nursing staff also have a duty to report to management any incidents of violent or aggressive behaviour. Within the workplace, staff must abide by the New South Wales Health Policy for Preventing and Managing Violence in the New South Wales Health Workplace, a zero tolerance approach. This document advises how to assess and prevent violence, as well as how to manage a situation after it occurs. Staff members that fall victim are entitled to support from management, access to counselling, transfer to another work area if requested, and a full investigation into the incident. As per the Incident Management Policy, a report must be submitted to the Incident Information Management System, IMS, and involvement of the police included if deemed required. Staff should be provided with violence prevention and management training and be allocated additional safety measures such as duress alarms if necessary. For continuous improvement, new findings should be reviewed and measures implemented to ensure effectiveness. Effective nurse leadership can drive safety and quality improvement by establishing and enforcing the acceptable behaviour, and can be key to changing attitudes and actions around disruptive behaviour. Nurse leaders have the ability to make positive effects on the workplace by fostering an aggression prevention climate, engaging family support of violent patients, and facilitating co-worker support. Emotionally intelligent nurse leaders have the power to address dysfunctional workplaces by modelling values and managing conflict through the use of informal influence This combats lateral workplace violence, bullying, and violent patients. Their professional background places them in an ideal position to understand political, economical, and social constraints. Strong communication and collaboration with senior staff and colleagues allows for successful conveying of grievances and implementation of new policies to facilitate positive change. Patient safety is optimized and positive outcomes are also increased as effective leadership has led to a proven reduction in behavioral problems and use of restraints. Nurse leaders integrate clinical expertise and leadership skills to deliver evidence-based practice and improve efficiency, making them ideal to manage systemic concerns and implement solutions. Clinical leadership is an attribute of an individual and member of a team to inspire and motivate others who are working toward a common goal. The healthcare system is dynamic and ever-changing. To remain beneficial to health outcomes, nurses must actively engage on both a personal and professional level. The contemporary healthcare system requires skilled nurses to practice to their full extent of their education and training and progress on to achieve higher levels of education. Nurses should actively participate in data collection and combine theoretical and clinical education. By including an element of leadership, they should also develop innovative approaches to convey procedures and policies and lead by example to deliver effective nursing care. Crucial skills include effective communication, critical thinking, and asking peers for feedback to influence clinical outcomes and ensure patient safety in a healthy workplace. As a newly graduated nurse, your objective is to demonstrate the qualities of an aspiring nurse leader while working within your scope of practice and abiding by the Nursing and Midwifery Board of Australia's professional standards, including standards for practice, code of conduct, and code of ethics. Principle 1 of the Code of Conduct for registered nurses states that we must practice in accordance to the law and directs mandatory reporting of such behaviour as violence or bullying. Principle 3 relates to cultural practice and respectful relationships and demands nurses report bullying and harassing behaviour, especially when it affects public safety. Principle 7 promotes their health and well-being and directs nurses to act to reduce stress that hinders their ability to provide safe care, which includes the detrimental effect on the psyche post-violent behaviour. Health advocacy addresses disparities and outlines a duty to use expertise to influence and advance health and well-being of individuals. Registered Nurse Standards for Practice 6 requires a provision of a safe quality nursing practice and contribution to quality improvement and research, which necessitates the reporting of incidents for investigation. Maintaining capability for practice is essential, as new research will bring changes in policy and procedures from evidence-based practice. Individuals should engage in a lifelong approach to learning and actively engage in their profession by adapting and implementing new procedures to ensure better health outcomes. Standard 7 requires nurses to evaluate outcomes and communicate problems to facilitate progressive nursing practice and ensure positive change in the workplace. Morally, and as per the International Code of Ethics, nurses should demonstrate responsiveness and integrity, support evidence-based practice, and operate in a safe manner to contribute to a safe and healthy work practice environment. Contemporary research shows that workplace violence is one of the most hazardous issues faced by nurses. A study report from 1,454 nurses and in violence in their workplace found that mandatory training is not always provided to staff in the workplace, and much of the training that is undertaken is an online setting and not thorough enough to be effective. This in-service has been prepared in the interest of influencing change and demonstrating leadership due to the likeliness of violence against less experienced staff such as new graduate nurses, and the statistics on employees not receiving mandatory training. Given the apprehensiveness of nurses to report violence and the inadequate training that some staff receive, it is imperative that nurses are reminded of the negative effect caused by violence and the training and support available to them. As a new graduate registered nurse who is highly motivated to see a reduction in violence in our workplace, this presentation is intended to address the issue. I anticipate that you understand the importance, undertake formal training and personal development, and contribute to a solution. My hope is that you take a moment to reflect upon this information, utilise the policies available to you, and implement strategies into your practice.